So there are summary of changes for 2021. 39 codes changed in validity, so went from valid to invalid codes. 19 codes were deleted from the classification. 490 codes were added to the classification, and 47 codes were descriptions that were revised. Highlights of the changes. 3 codes to capture CKD3 were implemented, and I'll go into those later. There were 57 musculoskeletal codes, including several in the category M24, other specific joint derangements. 21 codes to describe withdrawal from substances, including alcohol, cocaine, and opioids. 18 detailed codes for sickle cell anemia. So they've made it more specific now, and there's a couple of examples there. 128 additions to Chapter 19, which are injury, poisoning, and certain other consequences of external causes for adverse effects. And these are adverse effects for like fentanyl and tramadol and things like that, other synthetic narcotics. 125 additions to Chapter 20, the external cause codes, and it looked like most of these were specific to pedestrian accidents, so they gave more detail for pedestrian accidents. And then there was a new chapter, Chapter 22, codes for special purposes, and there's only 2 codes right now, U07.1 COVID, which took effect the earlier part of this year. So there's a lot of changes in the guidelines too, specific to COVID coding, and there's a lot of direction now on how to code COVID. Deleted codes. In the final update, these codes were deleted. The Q5120 code was deleted, and 18 codes from the T40.4X, poisoning by adverse effects codes, were deleted. Start with Chapter 1, certain infectious and parasitic diseases, and of course, this is going to be specific to the COVID coding. The code only confirmed cases, so only code U07.1 if it's a confirmed case of COVID. And then, of course, that's going to be from a positive test. If the provider suspects, possible, probable, or inconclusive, don't assign the COVID code, but instead assign the symptom code, fever, malaise, fatigue, whatever the symptoms the patient may be experiencing, and they determine that they're going to send them off for testing, and the testing hasn't come back as positive code to symptoms. Or there's the Z code for suspected exposure and whatnot. There are guidelines for coding for sepsis related to COVID. There's guidelines for coding COVID with pregnancy, in newborns, acute respiratory manifestations, and some of these are pneumonia, bronchitis, lower respiratory infection, acute respiratory distress syndrome, non-respiratory manifestations, so on and so forth. So read your guidelines to see all the different changes. Chapter 3, disease of blood and blood-forming organs. 18 new detailed codes available for the sickle cell anemia, and all of these codes can be found in the front of the ICD-10 book in a section that's colored red. They have all the different changes in there. These codes describe the complications associated with sickle cell and hemoglobin. And an example here is new sickle cell thalassemia code D57418, sickle cell thalassemia unspecified with crisis with other specified complications. And then it also tells you to code any identified complications, and it gives you a couple examples. Chapter 4, the endocrine. These include new coding instructions to follow for diabetic patients treated with insulin, oral hypoglycemics, and injectable non-insulin drugs. So what it says now is if the patient is treated with both insulin and injectable non-insulin diabetic drugs, assign codes Z79.4, long-term current use of insulin, and the Z79899, other long-term drug therapy. If the patient is being treated with both the oral hypoglycemic drugs and injectable insulin, use both codes, the Z7984 and Chapter 5, mental, behavioral, neurodevelopmental disorders. So there are 21 new codes that describe withdrawal from substances, including alcohol, cocaine, and opiates. These are some of the examples. F10.932, alcohol use unspecified with withdrawal with perceptual disturbance, and then opioid use with withdrawal, and then sedative, non-hypnotic or anxiolytic abuse with withdrawal, and then the 6th character has 3 different options: uncomplicated, delirium, and perceptual disturbance. Okay, Chapter 6, the disease of the nervous system. There are a few parenteral updates and revisions. They added pseudotumor as a clarifying term for G93.2. And there's also some code revisions and additions to these particular categories. Coders are restricted to code G89.81, intracranial hypotension with G96.0X, cerebrospinal fluid when applicable. So these are the different categories. Cerebrospinal fluid leak unspecified, cranial cerebrospinal fluid leak, spinal cerebrospinal leak, and then other cranial and cerebrospinal leak. Summary of changes for Chapter 9, Disease of the Circulatory System. It contains many revisions to the includes and excludes notes for the existing codes. For example, atherosclerosis of native arteries of the legs with ulceration now includes both critical and chronic ischemia of native arteries with ulceration. The hypertensive heart disease has been revised to exclude Takotsubo syndrome, and also known as broken heart syndrome. A new hypertension guideline provides instructions that when a patient has hypertensive chronic kidney disease and acute renal failure, codes both conditions and sequence the codes based on the reason for the encounter. Previously, it always says acute first and then chronic, but now you're going to sequence it based on why the patient is presenting. Disease of the respiratory system now has codes, also instructions for cases of acute laryngitis and tracheitis, and acute obstructive laryngitis and epiglottis. Coders are restricted to code also influenza if present, including influenza due to identified novel influenza A virus with other respiratory manifestations. This chapter also has a new section in the guidelines, 10.E, specifically for vaping-related disorders. So for patients presenting with conditions related to vaping, assign code U07.0, vaping-related disorders, as the principal diagnosis. For lung injury due to vaping, assign only code U07.0, assign additional codes for other manifestations such as acute respiratory failure or pneumonitis. Associated respiratory signs and symptoms due to vaping, such as cough, shortness of breath, are not coded separately when a definitive diagnosis has been established. However, it would be appropriate to code separately any gastrointestinal symptoms such as diarrhea and abdominal pain. Musculoskeletal System, Chapter 13. There are several updates, including 12 new codes to capture other pathological fractures. Updates include an expanded list of codes for rheumatoid arthritis, as well as primary and secondary arthritis and arthritis caused by trauma. New codes in the M24 category for other articular cartilage disorders, disorders of ligament, pathological dislocation, recurrent dislocation, and contracture and ankylosis. Disease of the genitourinary system. So chronic kidney disease stage 3 has now been broken out into 3 different codes. N18.30, stage 3 unspecified. N18.1, which is chronic kidney disease stage 3A, and N18.32, chronic kidney disease stage 3B. Now, we as coders can't interpret, even if they give you the test results and you know the criteria or the result range, we still can't diagnose it. So you can either query the providers or code to the unspecified if they don't state it specifically themselves. In the past, I have seen my providers list the different A's and B's, but back then it was only one stage. Now at least they have it broken out. So it seems to be a common staging. It just didn't have its own diagnosis previously.
Hi, this is Amy. Can't hear me? Let me know. So here on slide 22, there's a section on sepsis. For infections following an obstetrical procedure, use a code from O86, infection of surgical wounds, not the O85, peripheral sepsis. I have such a hard time saying that word, peripheral. That's what this slide is about. So on the next slide, 22 through 24, are references on coding for pregnant COVID patients. So when the pandemic started, CDC gave recommendations on coding for maternity patients with confirmed COVID. And ICD10 has written some new guidelines in sequencing. So the O9851 viral diseases plus U07.1 as a primary code. Previously, you would put the specific code first and then the COVID virus parasite. So that's a switch. Or what is that? So for the COVID diagnosis, you put 98.51 first. So COVID goes first now.
Oh.
Previously it would be respiratory failure, and then COVID. Now it's COVID. So you can go down to the next slide, right? And 25. That's what those slides are about. So going to slide 25, there are 5 new codes in this chapter. 2 of the codes, 034.218 and 034.22, relate to maternal care for cesarean scars. So in addition to maternal care for a low transverse scar, a vertical scar, and an unspecified scar, there's a 034.218 and 034.2. And you might say, what is an NEO? Well, what it is when you have a cesarean section, there might be a little pocket on your uterine scar, and I was just reading up on it, and it can cause placental problems in the future. Pelvic pain, abnormal pain, and infertility. That's it for Slides 26 and 27. There are 3 other new codes expanding the old 9989. It used to be everything was lumped together as pregnancy, childbirth, and puerperium, and now it's all split up. And then the next slide is to remember that you have to identify the condition. Add-on code. And the next issue.
Chapter 16, certain conditions originating in the perinatal period. There's a new section in the guidelines for indicating how to code with COVID. Newborns that test positive for COVID-19 assign code U07.1 and the appropriate codes for the associated manifestations in the neonate newborn, in the absence of documentation indicating a specific type of transformation. So just again, new guidelines to use specific sequencing and codes. Chapter 17, congenital malformations, deformations, and chromosomal abnormalities. Again, the deleted code Q51.20, doubling of the uterus, unspecified, and all codes within this subcategory were deleted. There were some wording changes to Q51.21, complete doubling of the uterus, Q51.22, partial doubling of the uterus, and Q51.28, other and unspecified doubling of the uterus. Chapter 18, signs and symptoms. There are several changes, the most significant one being the headache. Headache is now split into 2 codes. So it went from R51 to R51.0, headache with orthostatic component, not elsewhere classified. And another description was headache with positional component, not elsewhere classified. And then R51.9, headache unspecified, and this is also facial pain. Another source of new headache coding will come from 5 new codes for intracranial hypotension, the severe orthostatic headache that is a common symptom of cerebrospinal fluid leak. And here are the 4 different codes: intracranial hypotension following lumbar cerebrospinal shunting, and then intracranial hypotension following other procedures. And then again, refer back to slide 16 for those leak codes. Chapter 19 changes. Injury, poisoning, and certain other consequences. 128 additions that include new codes for adverse effects and poisoning by fentanyl and tramadol, as well as other synthetic narcotics. And these are just some examples. Many of the changes were because they added the bilateral locations. So instead of having to code 2 different codes for left and right, now they have bilateral options. And they've also added an option for the middle location. So if it wasn't left and it wasn't right, you only had unspecified. Now it was a middle location, like central chest or whatever. Now you have the option of choosing a middle location. The poisoning and adverse effects, they have poisoning by fentanyl or fentanyl analogs, accidental, meaning unintentional. You have intentional self-harm, you have assault, undetermined, you have adverse effects, and underdosing. So many of those for the different categories equate up to the 128 different changes. Chapter 21, factors influencing health status and contact with health services. There's new language that creates a second exception to the rule that observation codes are primary. The guidelines state an observation code may be assigned as a secondary diagnosis code when the patient is being observed for a condition that is ruled out and is unrelated to the principal first listed diagnosis. So a lot of times the observation codes, like the COVID, you can many times you list the COVID observation code as the primary. So now it's saying you can list it as secondary. And they give an example. A patient presents for treatment of the following injuries sustained in a motor vehicle accident and also observed for suspected COVID infection that is subsequently ruled out. So the principal diagnosis, you code for the injury or the accident, right? And then the COVID is the rule out. When a principal diagnosis is required to be coded from a category Z38, live-born infants according to place of birth and type of delivery, then a code from category Z05, encounter for observation and evaluation of newborn for suspected disease and conditions ruled out, is sequenced after the Z38. So just examples again of how to sequence the codes. Again, chapter 22, brand new chapter, codes for special purposes. There are only 2 codes in this chapter right now. The vaping related disorders, U07.0 and U07.1, COVID related conditions or COVID. Quick update, CPT changes for 2021. There are 329 editorial changes for 2021. There are 206 new codes, 54 deletions, and 69 revisions. 63% of the new codes this year involve new technology services described in category 3 CPT codes and continued expansion of the proprietary laboratory analysis section of CPT code set. So I think a lot of these are COVID related changes. Discussion.